Well, hello everyone, and welcome back to our Friday Live, which we do every Friday at 11:30 Hawaii time. And we are really pleased to have Miss Margaret Wong back here joining us. And this time, she's on the previous time, we got some very valuable information on Medicare and Medicaid and how she's been able to save so many people so much money. So this time around, we're going to be talking more specifically on providing the increased benefits to the veterans that have Medicare. So here today to talk about how Medicare for veterans and TRICARE members, our guest, Margaret Wong of Copeland Insurance Group. Margaret, thank you. Thank you for joining us. Welcome back.
Thank you for allowing me to come back. It's a wonderful opportunity to talk to your audience. And we have so many veterans and TRICARE for Life retirees here in Hawaii that I thought this might be a topic that might be helpful to some of your listeners.
And especially with the Military Appreciation Month coming up in May,
yes.
We're kind of getting a head start on that appreciation. So Margaret, can you share with our viewers a little bit about some things that anyone that has TRICARE or is a veteran that has Medicare, like what do they need to know?
Well, for TRICARE members, when they retire at age 65, to get the TRICARE benefits, they have to apply for Medicare Part A, which is your inpatient hospital and nursing home, as well as Medicare Part B, which are the outpatient services. And there is a cost for Medicare Part B, and it will be based on their adjusted gross tax return 2 years prior. So for anyone that is single, making less than $86,000, the base rate in 2021 is $148.50 per person per month. For couples, it's $176,000. So if their income is higher, then there would be a higher rate for Part B. This is set up by Social Security, and it is being charged by Social Security. So once they have Medicare A and B, they should really consider Medicare Advantage plans. These are plans that may be zero monthly premium that can supplement and complement their benefits with TRICARE or their VA benefits. Because for veterans, they have excellent healthcare benefit through their VA and facilities. But going to the VA facility sometimes can be very far away, so they have to travel long distances. Whereas under Medicare, they can go to a lot of doctors outside of the VA facilities where they'll be able to get access to urgent care, get access to emergency rooms, and a lot more doctors that will be able to complement the benefits they have with the VA. And also now with the Medicare Advantage plans in 2021, there are plans that will actually give you back $30 a month in their Part B premium, depending on their zip codes. So there are so many moving parts to Medicare that we really want to ensure that our veterans and our seniors understand all the benefits that are available to them so they can get access to them. Also, there are dental included.
I was going to say, so Margaret, with all of the ins and outs and the things that, you need to know on Medicare, I mean, I just, hats off to you with you, like personally making this a specialty, and you are constantly studying and trying to figure out like what is going to be the best path of travel for each one of your clients.
Absolutely.
If any of our listeners or viewers have questions, like how did they connect with you, or does it cost them money to have you consult with them and to help them? How does that work?
Well, absolutely no costs and no obligation. We feel that this is a benefit that they've earned and they've paid into, and we want them to take advantage of all the benefits that's available to them. So they can give my office a call at area code 808-591-4877, and we'll be able to answer any questions. Granted, we don't have access to all the plans like Kaiser. will only take care of their Kaiser members through their agents internally. And of course, HMSA also has very specialized agencies that they work with. But we have access to all the other carriers that we feel will give them good options, and we'll be able to answer questions regarding them and help them customize the plan that's going to meet their needs and their budget.
So, Margaret, who would be like the ideal person that would benefit from your expertise and, the consultative approach that you guys take? Who's your ideal person?
Anyone that's 65 and above that have
Mm-hmm.
Medicare Part A, inpatient hospital, and B, outpatient services. Once they have Part A and B, they can give our office a call and we can help them go through the process of understanding the plan that's going to best meet their needs. If there are veterans that are under 65 that has been in Social Security disability for 2 years,
Mm-hmm.
they will also qualify for Medicare Part A and B. Granted, they have access to their veteran benefits, healthcare benefits, but I think by considering the Medicare benefits on top of that will really enhance their um, access to care as well as extra value benefits.
It sounds like there's additional options. So,
Absolutely.
for the veterans that are under 65, would those be veterans that are maybe 100% disabled, would be the ones that are eligible for the Medicare A and B? Or how does that work if they're under 65?
If they're under 65 and they qualify and have been covered by Social Security disability, I know
Okay.
disability within the veterans, but it has to be the Social Security disability for 2 years. Once they qualify for that, even though they're under 65, they will be able to have their Medicare Part A and B. At that time, they can give us a call.
Nice. So, Margaret, do you have any success stories that maybe you could share about veterans that you've been able to make a big impact with through helping them navigate through this Medicare A and B and this Advantage plan?
Well, we have a couple of veterans that has contacted us, and also for people that are retiring after 65 or after coming off the work, because a lot of people have served years ago and don't realize they have these veteran benefits that they qualify for. So we are there to help them navigate through all of this. We help them apply for their Part A and Part B, and once they have that, we can help them take a look at some of these plans that might give back the $30 of Part B premium. And some of them have a lot of additional benefits like dental and vision and hearing aids. So again, we look up their doctors, we look up their medication if they're willing to disclose that to us so that we can customize the plan that will benefit and customize to their particular needs and their budgets.
Nice. So, on average, as far as like the cost savings, right? Because what you're offering seems like to be able to consolidate and to be more efficient with the plans. So, on average, how much money would you say like a veteran or even just someone who's not a veteran, one of your clientele that you've been able to help navigate and connect them with the right plan? How much money on average are you guys saving your customers?
Literally hundreds of dollars, especially the added value benefits that are included with the plan at no additional cost to them. Like the dental plan, some of them will offer $1,000 of included dental at no additional cost. There are hearing aid benefits, health club member benefits. So there are so many added value that a veteran, as well as any senior that has Medicare A and B, can take advantage of. And that's what we want to do is that there's 21 different plans to choose from under Medicare Advantage. So it's very hard to figure out which of those plans will meet their needs because it is based on their zip code where they live. If they're on the outer islands, certain islands will have certain benefits and others don't. But people on Oahu have the maximum benefit. So we are on all the islands and we're able to help everyone.
And I know with our seniors, a lot of them have retired and they're on a fixed budget, or maybe they're working part-time and they're on a fixed budget. So having this this tool and this resource through you and your company could make a huge difference
Yes.
in their quality of life.
Absolutely. And we always do an annual review if they allow us. So when around September, we send all of our members a card reminding them that between October 15 to December 7th is their annual enrollment period. So everyone in the entire country that qualify for Medicare can make a change. So we send them a reminder card for them to contact us, let us know the changes in their medications or their doctors or their health issues so that we can customize the plan offerings in the following year that will basically meet their needs and give them the maximum benefits.
So Margaret, with these different plans and things constantly changing, I mean, how often are new benefits coming in and other benefits going away?
Every year, all the carriers will analyze their benefits and see
Mm-hmm.
what additional added values that would like to include. And I mean, the benefits, added value benefits are absolutely awesome. So we tailor the benefits based on the needs of the individual so that they can take advantage of it at no additional cost to them or very basic cost to them. So bottom line, we want to save all of our seniors dollars because right now the economy is pretty scary out there, and we want to save people money as well as offer them added value benefits.
Sounds like it's a full-time job just trying to figure out this Medicare benefits that are constantly changing and things coming and going. And yeah, so, hats off to you as far as making that your specialty and your mission, right? To help our seniors in our community. Now, you had come to us through one of our clients who just we helped her to sell her home, and
Right.
she was very sad to leave you.
Yes.
Um, but she just had she was a raving fan of what you've been able to do for her and her family and save her a lot of confusion and stress with her medical plan. So she's relocated to Phoenix, Arizona. Now, what happens if someone's watching and they're not on Oahu? Do you guys have resources all over the United States? How does that work?
Absolutely. A lot of our Hawaii residents moved to the mainland. In fact, I touched base with Eileen to see how she's doing. I have an excellent office and staff there. I'm familiar with Hawaii. I'm not familiar with the other plans because I have 21 to understand here in Hawaii. So when people move out of Hawaii, I always refer them to my associates on the mainland. We're in 20 different cities across the country, and we will have associates like myself that will be able to be experts in their area as to the plan that will meet their needs. And they have about 60 days to make that change. And so we're helping her with that process.
Nice. So the age to apply for Medicare is it's 65,
Yeah.
or you have to be on Social Security for some reason.
Social Security disability for two
Just
years if you're under
for
60.
2 years.
Yes.
Okay, so those are the people that you can help.
The guidelines. Yes.
You can save them money. You can
Yes.
help save them stress and
Yes.
time because you've already done the research.
Absolutely. And throughout the year, things are going to happen. And so we're just a phone call away. And that's what we tell our clients. Even those that sometimes move out of the Hawaii, they still like to stay in touch, which I love. And so we keep in touch with all of our members because they become valuable friends as well as clients. And, I'm a senior myself, so I can relate to that. And there's a lot of training that we have to go through, a lot of certification that we have to go through every single year because these plans will change. And we want to make sure that we have all the information to give our members the maximum benefits.
So thank you, Margaret, for sharing with us about a little bit about the benefits that are available to veterans
Thank you.
and also the non-veterans, just our seniors. So
Yes.
we'll wrap things up on this note. What made you decide to get into this line of work? Like, what was your big why?
Well, my core business prior to dealing with Medicare was on the group health insurance business market. So in 2006, when President Bush decided to implement the drug coverage, I thought, well, I already have a lot of businesses and members in my book of business, and we're all going to get older. So learning about Medicare was a very easy transition. Granted, there's still a lot of training involved, a lot of certification and learning involved, but I love it because my clients become my friends, and we create long-term relationship. And having a trusted person to go to is, I think, very valuable, and that's what we hope to provide.
Sounds like as your business was maturing, as we can say, that
Yes,
you decided to make some changes to adjust for your clients' needs,
absolutely.
right? So that's excellent insight to
Thank you.
do that, so you can continue to serve them at a very high level.
Absolutely. In fact, we have a lot of retirees. We tell people, hey, if you're tired of golfing every day and you're starting to get bored, you already understand how confusing Medicare can be. And if you want to learn about this, I would love to have you learn this. It's a lot of
Mhm.
training involved, but we welcome everybody that has a heart for seniors.
So with that being said, I know not all seniors are as tech savvy as you are.
So,
How does that work as far as the consultation, especially with COVID and just where we're at right now? How are you handling that?
well, we do phone interviews. Those that are, you'd be surprised how many seniors are tech savvy. And
Mm-hmm.
so we will do the Zoom if they are comfortable with that. Um, some people would like to come into my office. I have a sanitization system in my office that will keep our offices free of germs, and it's always sanitized. And also, some will actually I can go to their homes, and they're sitting on their porch or their patio, and I'm in my car. We'll talk over the phone because sometimes people like to see things face to face. Local
Mm-hmm.
people like that personal touch. And luckily here in Hawaii, we don't have to travel that long to get to places. So again, we do whatever's most comfortable to make sure that the seniors get the information they need. And more importantly, we encourage their families to get involved so that the families understand what is that we're doing for their parents. So um, we make it work. Telephone's always the best way. Face to face is the other.
Well, I love how you've made adjustments to continue to serve your clients, whether it's because you guys are all aging together, or to keep them safe during COVID,
Yes,
and continuing to innovate in your industry and be that go-to person and the expert. So thank you, Margaret, for coming back to our Friday Live for a very important topic, because it's confusing. I mean, I am not looking forward to turning 65 with all of these options.
yes.
So yeah, I mean, thank you for being here for our seniors and helping them to take that confusion out of the Medicare system and the
Thank you so
plans.
much for this opportunity to talk to your listeners and all your clients.
Okay, and I'm going to put your email up one more time in case anyone needs to write it down. And then I'm going to put your phone number, the 591-4877, to give you a call.
Fantastic. Thank you
Well,
so much.
thanks. Yes, thank you, Margaret.
Take care.
Wonderful to see you again.
Yes.
And thanks for all you do. So just stay with me. I'm going to end the broadcast.
All right. Thank you.